Thank you, Honourable Speakers. I, at the outset, would like to thank you for admitting this short duration discussion on the Rules 50 of the Rules of Procedure and Conduct of Business pertaining to the news item appearing in the Shillong Times 11th July 2022 on the present condition of the health sector in the state, sir. Sir, the health sector has always been under rigorous scrutiny, considering the various ground challenges, the impact on the people's lives, and parameters that it is gauged by. So the national monitoring agencies and various other agencies have been very hardworking, and they have been guiding the various states, giving insights on the progress of various health indicators to show or to guide the states on how to move forward and improve the health facilities in the respective states. So recently several parameters have been brought to our knowledge to various reports. As per the Rural Health Statistics report, sir, the shortfall of rural health facilities is over 46%, which is higher than the national average of 24%, sir. So therefore, sir, this indicates that we need to speed up the setting up of rural health infrastructure, which, as per the growth rate of the state and the population growth, we need to attend to the requirements of the people across the state. A huge shortfall of 46%, sir, which indicates that many habitations are still far from the health facilities, and therefore becoming challenging for the people to get immediate medical assistance and also to get the medical services as and when required, sir. Sir, I had earlier proposed to the department, sir, for setting up of the sub-centers or the health and wellness centers at Umkti and Nong Trao village, and also for upgrading the old Umyam state dispensary, sir, to the PHC, sir. And considering these figures at the national level and also the state level, sir, therefore it is important that such facilities in my constituency and perhaps in other constituencies also need to be speeded up, sir. So the National Family Health Survey, the NFHS 5, 2019-20, which is the latest report available to us, the neonatal mortality rate has increased to 20.6 per 1,000 births, sir, in rural areas in our state. The under 5 mortality rate has increased to 42.6 in rural areas per 1,000 births. And as per the latest SRS Bulletin 2022, the infant mortality rate of Meghalaya is the highest amongst the smaller states, sir, standing at 30 for rural areas and 16 for the urban areas, sir, which takes the state average at 29, still the highest amongst the smaller states. This is really alarming, sir, considering that the IMR is one of the critical indicators of child health and also on the kind of facilities at which people have to get access in terms of infants and to give much attention to them, sir. Sir, children under 5 years who are stunted height for age has increased to a staggering 46.5%, sir. So this is really alarming to see, sir, that the deprivation of nutrition for our children is there at such an alarming figure, sir. It was expected that the various nutritional programs of the government would in fact address this issue of stunting, where we have seen high growths in the past. And in fact, with these interventions of nutritional programs, it was expected that the stunting growth would have decreased. But this latest figure of 46.5% still shows that our nutritional programs have not been bearing the results that we expect. Recently, sir, we also have seen that the rice that was meant for children's nutrition program was siphoned off and caught there in Assam with lakhs of rice that was meant for children. So we also learned that there was an inquiry into it, but then the inquiry report is yet to be made public, sir. So therefore, sir, with these staggering figures of stunting, it is important to know as to what has happened to the inquiry report, sir, on that rice smuggling scam. I, on the behalf of the opposition, sir, we demand that the government tables the rice scam report for the information of the people. We cannot compromise on children's nutrition, sir. And such blot on the system and on the program brings to fore the inadequacy in monitoring system and also in the implementation of the program as a whole, sir. So, in an alarming new finding, child marriage in rural Meghalaya has increased to 19.1%, sir. So, child marriage has been one of the reasons of many problems that we see in the rural areas, sir. Stunting, anemic cases, and even single mothers has been seen as one of the factors that are really pulling down our households in the rural areas. And such a staggering find of 19.1% in terms of child marriage in rural areas needs to be looked at, and perhaps a comprehensive policy be brought as to how we tackle this issue in order to sensitize our youths and also our mothers on how we can address this particular issue, sir. Sir, the government has taken an initiative, and as presented in the House several times, on the Mother app, where it is using it as a monitoring tool to see that mothers, they are attended in a much better manner. Much appreciated, sir. Monitoring is one of the key tools to ensure that the services that are being rendered by the government, they reach the patients, they reach the mothers and the citizens across the state. However, sir, we also require a holistic policy on this towards pregnant and lactating women. Access to nutrition, access to awareness, access to health facilities, which we have seen, as I had said, being lagging behind by at least 46% in terms of access to health infrastructure and facilities. Perhaps this needs focus. Because if this policy combined with infrastructure is not there to address the problems of pregnant and lactating women, we will have all the other problems that I have already narrated. So, Meghalaya is now being tagged as the country's cancer capital, where 1 in every 5 male and 1 in every 9 female, they have been affected by this dreaded disease. This is as per the ICMR NCDIR 2021 report, sir. Therefore, sir, cancer care needs to be thought of in a better manner, improving the services, even though facilities have been initiated in our civil hospitals, sir. Just the other day, we were narrating all these problems of cancer patients in our civil hospital. The reports are very long delayed. So 3 weeks, 1 month, more than a month, if the reports are delayed, then the disease is also eating into the patient's body. So if the reports are delayed, then the lives that we are supposed to save, sir, we are putting them at risk. This is one very, very important feedback that we would like to give to the government, sir, that the reports, especially for the cancer patients, they are inadequate, delayed, and therefore putting the citizens' lives at risk. So, the Shillong Medical College is further delayed due to the new terms and conditions and the activities that the government has again reset it and pushed it in a different direction with expectation, with perhaps new norms, as has been informed by the Honourable Minister of Health. But the expectations of the youth, sir, has been derailed.
I have 1 minute.
Sir. So questions are being raised also on the staggering and mind-boggling figure of COVID expenditure, sir, which has crossed 1,000 crore. Perhaps this is one of the highest in the country, sir. So, sir, people are amused rather at the way the government has spent this entire important resource and precious resource. So the recruitment of nurses, as for the recruitment of teachers and police, the recruitment of nurses is also still pending, and we have our facilities affected because of the problems which we already know, the roster system. And our youths who have applied for the posts, they are eager to know and anxious about their fate, sir. So these are the points that I would like to bring and highlight before the government, because the other day the Honourable Chief Minister was kind enough to tell us about the high spending of the government and the increase in the kind of resources that and investments that they're trying to push to the state, sir. But then, sir, if things are not improving, especially for our rural areas, perhaps these resources need to be looked at as how they are being spent in order to ensure that the facilities, they reach the people, and improvement in all these various indicators of health be of improvement and also a sign of hope for the state as a whole, sir. So, therefore, sir, we need a collective endeavor and focus in order to ensure that we attend to the ailments of the health sector, sir. And with these few submissions, I hope that I have drawn the attention of the government, sir.
Thank you very much.
Mr. Speaker, sir, I would like to thank you for giving me this opportunity to take part in the short duration discussion with regard to the present condition of the health sector in the state. Sir, since our member has, I know so many members will be discussing about the present condition of the health sector in the state. So I will be specific, sir, with regard to the health sector in Jaintia Hills. So as we all know, and I've seen from time to time that the health condition of Jaintia Hills is in a really bad condition, sir, as of now. Just recently, sir, I met a doctor who was posted in Yalong Civil Hospital. So I got a complaint from him, sir, that from time to time, people all across Jaintia Hills, they depend on the Yalong Civil Hospital for even a minor illness or treatment, sir. We cannot imagine, sir, people all across Jaintia Hills, they will depend only in Yalong Civil Hospital. And when I go deep and when I try to inquire, sir, I came to know that most of the PHC, the CHC, that were there in different parts of Jaintia Hills, they are not functioning well, sir. And when they say that it's not functioning well, it does not mean that I'm going to blame the doctor. We know that the doctor have tried their best to perform their duties. But the thing is that, sir, only one doctor is available for one PHC, CHC. How could he perform his duty, sir? So that's why, sir, due to the non-availability of doctor and due to non-availability of medical equipment, people from different parts of Jaintia has to move towards Yalong Civil Hospital for their treatment, sir. And sir, point number 2, sir, and it's very important. I've been to Yalong Civil Hospital so many times, sir, and it is really shocking to see that all the corridors inside the Yalong Civil Hospital, they were occupied by the patients, sir. Patients are made to sleep on the floor, sir. That also not inside, but in the corridor of the hospital. Especially patients from the maternity ward, sir, because as we all know that the present maternity bed is only 30 in Yalong Civil Hospital, whereas patients who came daily, I think they cross hundreds, sir. So in the process, the doctors, the staff, they have no other choice but to make the patient sleep on the floor of the Yalong Civil Hospital, sir. That is such a condition with regard to the maternity in Yalong Civil Hospital. So therefore, sir, in spite the government has already finish the construction of the 100-bedded MCH hospital in July. But the big question is that, sir, when it will start operationalized, sir? Till now, we are yet to see the light of the day. Until now, the hospital is yet to be operationalized, sir. So that's why, sir, we hope that the government will take
5 minutes.
will take special interest, sir, will pay heed to the concern of our people, and to make the MCH hospital operationalized as soon as possible, sir. Another point is that, sir, with regard to the Yalong Civil Hospital, I'm talking only about Jaintia Hill, sir. It is really shocking, sir, to know that the ICU bed that was there in Yalong Civil Hospital, it is not functioning. It is really shocking, sir. Despite being one of the oldest hospital, and people used to think that Yalong Civil Hospital is one of the biggest hospital in Jaintia Hills, but it is sad to know that it is functioning without the ICU not functioning properly, sir. So that's why, sir, I would like to request the government to make this ICU bed functional as soon as possible, sir. I've seen the difficulties that the people of our Jaintia Hills are facing from time to time. Especially, sir, for the poor people who cannot afford to go all the way to Shillong to get a better treatment, or who can afford to go to a private hospital. For those poor people who depend solely on the help that are being provided by the civil hospital, if the ICU is not functioning, they are going to face a very big problem, sir. So that's why, sir, I would like to point out this point, sir, that the ICU in Yalong Civil Hospital should be made functional as soon as possible, sir.
Honorable member, please try to wind up because of the constraint of time.
And just one more point, sir. And last but not the least, sir, I would like to request upon the government, especially through our Honorable Chief Minister, sir, who has done a lot for our state. So there's one more very important request, and that is the setting up of a PHC in Block 1 area, sir. I've been requesting this time and time again and again, sir. But till now, we are yet to see the light of the day. People from Block 1 area, just imagine, sir, just to go to a sub-center, they have to travel all the way for 15 kilometers. Just to get to a sub-center, 15 kilometers they have to travel. From Moluber, from Mojem, all those Panar village, sir, they have to travel for more than 10 kilometers just to reach a sub-center. So that's why, sir, I would like to request upon the government, please and kindly look into the matter and make sure that a PHC will be set up in Block 1 area. That is my humble request, sir. And I hope that the government will take a very keen interest in the points that I have raised, sir. So with this very few points, sir, I will resume my seat. Thank you, sir.
Thank you.